Hi everybody, today I'm sitting here with Amanda. Amanda is a patient of mine, a young lady that I actually met working out at Powerhouse Gym. And we were discussing, I was working out with my trainers, Pete and Andrea, and she was next to us. We were talking about back pain. And she was like, I have terrible back pain, can barely work out. So I had her come see me. And she is now 4 weeks after an artificial disc placed in her low back. So she's a very physically active young woman, young mother, and working hard. And so we're here today for her follow-up at 4 weeks. How are you feeling?
I'm feeling amazing.
Amazing?
Yeah, it's the best I've felt in about 3 years. Yeah. So it's been a long recovery, or long journey to get here, but a very short recovery.
Great.
Yes.
And so you were active, I believe, after the surgery pretty soon, as I understand it.
Yes, very quickly. I would say roughly about a week afterwards. I was up walking around. 2 weeks, I was doing about 5 to 10 miles. And then now that I'm 4 weeks out, yes, 4 weeks out, I just did 10 miles on Saturday. So
10 miles?
10-mile hike at that as well. And
10-mile hike?
A 10-mile hike, yes.
Oh, that's amazing.
Yeah.
I didn't realize it was a hike. That's just more than I think I could do, actually. So are you ready to start doing more?
Yes, as soon as you give me the go-ahead, I'm going to definitely do more.
All right. Well, today is the day.
Woo!
So you're going to get to be much more active, because the purpose of artificial disc replacement is to maintain your motion, your flexibility, eliminate that pain. And if you remember, your MRI wasn't that impressive. You had a little tear of the disc of L4-5, and it didn't look horrible. So most doctors would say, oh, it looks fine,
right.
It's in your head, that kind of stuff, which I think you were experiencing.
Right, yeah, absolutely.
Yeah. And really just simple tears of discs. And so what I like to do in dealing with you and other patients is we want to treat the patient, not the MRI. So the MRI may not look bad, but the patient may have horrific symptoms. The reason is torn discs can have a lot of chemicals released that are very inflammatory and in some people it doesn't hurt, and some people it's tremendously painful. Right. So by replacing that disc with an artificial disc, which will last your lifetime, we've eliminated that pain now, and
absolutely.
So you feel great, right?
100%, yeah.
Okay, so we're going to get your life going again and get you back to your usual self. So once you go back to the gym, we're going to ramp up slow. Okay, I'll see you at Powerhouse Gym hopefully soon.
Yeah.
Okay, and we can start with, you can do upper body. I don't want too much vertical loading on your disc yet.
Right.
Okay, so no squats or anything heavy like that, or no heavy barbell on the shoulders. Okay. But you can go up to 20 pounds on military or shoulder press if you'd like.
All right.
You can do chest and back, laying down, anything laying down. Okay. Individual leg exercises are fine, lunges are fine. And then I want to start some ab core work.
Right, okay.
Okay. Not full on sit-ups yet, but we'll go partials. Okay, and Andrea can show you some really good ab band work for your abs, which are amazing, and without really hyperflexing or hyper-rotating. Then over the 4 weeks from now, then we'll get to full-on bending and all that. So at the eight week mark, you'll have your full activity back, and you'll be 100%.
Awesome. Perfect.
I'm really happy for you.
I know, I can't. I'm so happy as well.
So yeah, it's going to be a great recovery for you, and I'm very pleased. And I wanted to show not only you, but some other physical trainers and other people that are really active, and who are working, who have young kids, who are trying to take care of themselves, be fit, eat healthily, and maintain activity. Because every patient out there can get better and be greater than better, just by following these guidelines and getting back.
Right, and I thought, I'm too young for this, I'm 34, I shouldn't be experiencing pain. I shouldn't be experiencing pain, and honestly, I feel like I'm back in my 20s. So I feel better than ever, and it's just getting better.
Great, I'm so happy for you.
It's me too. Thank you so much.
All right. You're welcome. So I will see you I'll see you at the gym.
Of course.
And then I'll see you in 4 weeks formally.
Yep.
And then we'll advance more of the routine then.
Yeah, absolutely.
All right.
All right, sounds
great
good.
to see you. I'll see you soon.